having me. I represent Soluciones de Immunotherapy, and what we do with Soluciones are immunotherapy solutions for chronic disease states. The physician that is in charge of the cancer vaccine could not be here today, so I'm going to present the cancer vaccine in a very simple manner. I am not a doctor, so don't ask any hard questions, please. If you have hard questions, they go to Glenn afterwards. Okay? All right. The cancer vaccine is an autologous, programmable dendritic cell vaccine for solid tumor cancers. We have seen success in some solid tumor cancers. Glioblastoma multiforme is one of them. Another area we've seen some success has been mesothelioma, and also some success with breast cancer and carcinoma of the liver. The vaccine is still in its early stages, and as Dr. Alexander mentioned, or Dr. Bonner mentioned rather, we learn as we go along. So I'm sure there are lots of improvements that we're going to make. However, it's pretty exciting that we have a vaccine that can be derived from our own adult autologous stem cells that reprograms the stem cells into antigen-presenting dendritic cells that then attack the tumor. So what you're doing is you're teaching your immune system to attack the tumor. Okay, to qualify for a vaccine, a patient must have a healthy immune system. So if a patient doesn't have a competent immune system, the vaccine is not going to work, probably, so they wouldn't be a good candidate. I just went over this. A successful vaccine reprograms the patient's immune system to attack the tumor. So you're using your own cells to fight the tumor and destroy it. And that's important for a couple of reasons, because the tumor, as you guys know, may not always be localized to one place. You might have metastases that have gone around to different places of the body, and because the vaccine is systemic, your whole immune system is reprogrammed to fight that, even if there are little outlying cells in different areas of the body. And again, a properly prepared vaccine can be used on different types of solid mass tumors. And Dr. Alexander spoke quite a bit about the immune system, and it's really important to keep the immune system healthy and to boost the immune system. So one of the things that we recommend when a patient is undergoing the vaccine treatment is that they maintain a rigorous nutrition schedule so that their immune system can be the best it possibly can be to receive the vaccine, to learn from it and reprogram, and then attack the tumor. And we verify the competent immune system clinically with diagnostic tests before a patient undergoes the treatment to, again, make sure that they will be a good candidate. Okay? Prior to the vaccine, after the patient's immune system is tested, and say, for example, the patient qualifies because they have a competent immune system, we give them one injection of Neupogen. And what that does is it raises the white cell count, because this vaccine at this time is derived from a blood draw. And so we have not yet moved into the adipose world. So we give the Neupogen injection, we do a blood draw 36 hours later, and we verify the white blood count. And actually it says draw 20 mils of blood, we draw 100. So that is a mistake. And then we spin the blood down, take off the white blood cells, separate out the CD34 positives, and we expand those stem cells. So the CD34s are grown, expanded, fed, and then they're given a cytokine preparation along the way that's proprietary. And what that does is it directs the CD34s to maturate into dendritic cells that are antigen dendritic cells and are then ready to be exposed to the tumor. and that's an antigen-presenting dendritic cell. Okay. So then we have to go get a piece of the tumor. So you biopsy the tumor, get as much fresh tumor sample as you can, and expose it to the new mature dendritic cell populations and the antigens from the tumor. The dendritic cell picks those up, knows to go after those and attack the cancer cells. So before the vaccine is given to the patient, we confirm that there's a sufficient number of dendritic cells in each population, and then the vaccine is given to the patient, one vaccine once every 4 months, and then you reevaluate. And if more vaccine is needed, we save tumor cryogenically so that it can be used to make another vaccine later, even if it's a few years later. Okay? Reactions to the vaccine. Reactions to the vaccine so far are just equivalent to mild flu-like symptoms. You have a headache and general malaise and some achiness at the site of injection, maybe some redness, what you would expect from a normal vaccine. And of course, the response to the vaccine and the success are dependent on many, many, many variables. Some you can control, some you can't. For example, nutrition, you can control that. You can take your supplements and keep your immune system boosted. But your inert immune system, the whole thing depends on that, so you got to keep it healthy. I think that's it for this vaccine. Yes. So that's it for the cancer vaccine. We look forward to a very, very long and healthy and positive relationship here, helping people overcome this horrible disease and giving them an option that allows them to maintain their quality of life while they're fighting this disease, rather than options that might compromise the quality of life. That's the whole purpose behind this vaccine, is to allow a patient to maintain his or her quality of life. And again, all questions you can direct to Glenn later. Thank you.
Yes, we treated 10 patients. We had about a 50% success rate in terms of either diminution of the tumor by MRI, improvement in clinical response related to that effect on the tumor. And in a couple of cases, the glioblastoma, the tumor, evidence of the tumor by MRI completely resolved. And 2 of the patients that were treated for glioblastoma had already been given a death sentence of 3 to 6 weeks to live. And both of those patients were able to live and still, one of them is still alive, the other one died of an unexpected other issue. But they were able to live for, the one that did die was over a year, and the other one is still alive at this point. It's 3 years?
It's 4 years this summer, and he now has 4 children and a new chicken farm. So.
The chicken farm is the important part. We also had some I don't know if you can call it success, but there was one patient that had liver cancer that was treated, and the cancer did not resolve from the treatment, and ultimately had surgery. But at the time of the surgery, there was evidence of significant encapsulation of the tumor, emphasizing the fact that at least in those sections, the tumor was no longer invasive in the adjacent liver tissue, and we can't count that as a success. But at the same time, it raises I guess the thought that at least it didn't metastasize. There was also another patient that is listed in the mortality group, who was an older gentleman. I have to be careful using that term, but he was older. He did have some serious medical problems, and he was, at the time that he had lung cancer, and at the time he was treated, he came from an assisted care facility that was aligned with the hospice facility, and he did so well from the treatment that he was able to go home from the facility where he was being monitored and cared for, and his activity level got up to the point where he had a heart attack and died of a heart attack. There was also a nurse in the mortality group that had metastatic breast cancer, and she was very uncomfortable. She had stress responses in multiple lung bones in her spine, and she was really uncomfortable, and she did extremely well with the treatment, with the vaccine. And the other, not complication, but the other effect of the vaccine is that she noticed an increase in discomfort in the sites where she had metastasis for about 3 weeks after the vaccine. And in those same areas by MRI did start to show some resolution of the tumor sites that were metastasis, that had metastasized. She had had a shunt, a hepatoportal shunt in the past, and she had complications relating to that and had to have a revision of that shunt. And unfortunately, she died of complications related to that shunt surgery. So again, we can't count her as a